This was a poster presentation and an update on results that were presented at the ASH meeting last year, now including more patients with longer follow-up. So TAK-079 is an anti-CD38 antibody that is unique in the sense that it has a higher bioavailability for the target cell, the plasma cell, and less binding to red blood cells. So theoretically, therefore, it could cause less off-target side effects, notably in terms of cytopenias. The trial that was reported on at ASCO was a phase 1/2 trial, dose escalation starting at 45 milligrams going up to 1,800 milligrams as the planned maximum dose, given a traditional fashion similar to other anti-CD38 antibodies, weekly for 2 cycles and bi-weekly cycles 3 to 6, and then monthly cycle 7 and beyond. The update at ASCO reported on a total of 41 patients. Of note, 82% of these patients had prior stem cell transplant. Also notable was that 25% of them had a prior anti-CD38 antibody, and that 65% were double refractory to both an IMiD and a PI. Now, in terms of safety, we saw that this drug was very well tolerated. There was no infusion reactions, very rare mild injection site reactions, no significant lymphopenia or thrombocytopenia. And looking at outcomes, we also saw some favorable outcomes in terms of response rate. So once we reached the target saturation dose, we saw an overall response rate of 28%. So looking at anti-CD38 naive patients that were response evaluable at the 600 milligram dose, which is the chosen dose moving forward, the overall response rate was 36%, which is very comparable to the response rate with single agent daratumumab in some of the early initial studies. So the other notable fact now that this trial has been going on, that we've seen durability of responses with several patients being on therapy beyond 12 months, and also responses deepening over time, including a patient developing MRD negative disease by cycle 13. So this trial is continuing to accrue patients and also exploring combinations with this regimen, given the very favorable hematologic toxicity profile. It's currently also under study in combination with pomalidomide.